The Association of Community Pharmacists of Nigeria, FCT branch, held a summit in Abuja titled Community Pharmacists Untapped Potentials in Primary Healthcare Delivery in Nigeria, where the association touchlighted areas where pharmacists should indulge in to foster and promoting a quality healthcare delivery in the country. The summit also highlighted roles of pharmacists in delivering their untapped potentials in terms of delivery in Nigeria. They also saw the need for the government to recognize the potentials of pharmacists in the nation. The summit was also followed by a presentation by the Novartis drug company introducing coartem dispersible drugs, and a series of other educating presentations by pharmaceutical-related bodies. While speaking to the press, Famweyep Nimnam Nakab, the chairman of the ACP in Abuja, saw the need for the government and general public to recognize the role and importance of pharmacists in delivery services. He also reiterated on the role of pharmacy in the COVID-19 vaccine administration, adding that the government should emulate the footsteps of other countries.
We're here today to observe the Pharmacy Week of the Association of Community Pharmacists of Nigeria, the FCT branch, which has a team, the untapped potentials of community pharmacists in primary care. Of course, it's a rider. The team derives its root from our national conference of 2020 that we observed here in Abuja, where we signed a declaration called Abuja Declaration, a commitment of community pharmacists to provision of primary care services in Nigeria. Of course, it's also not just, it's not a topic or team that is coming from nowhere. It's a team that is coming from the international community. It's a team that is being promoted, a project that has been promoted by the International Pharmaceutical Federation in collaboration with the WHO, and that is what we have come to domesticate in Nigeria. So we've taken it. It's a project, like I said, it's a project of a partnership project between the WHO and the International Pharmaceutical Federation, and this we have brought down here. The declaration we signed in Abuja in December 1st, 2020 was the third declaration in the row. The first declaration was signed in 2018 by, in Astana, which is called the Astana Declaration of WHO and FIP. Unfortunately, we have not enjoyed the kind of support we should have enjoyed from government. This is very unfortunate, because if countries like America that were more developed than us in terms of their sectors, in terms of their health system, and even having more practitioners today, you can count the numbers of Nigerian doctors, pharmacists who are in America. And if America is taking benefit, one of the presidents of America at the time in the 60s says, that pharmacists are so important that if we do not have one, we may have to invent one, we may have to manufacture one. But unfortunately, in our own climes in Nigeria, this has not happened. We have not enjoyed the support of government in this regard. We are doing them. We are doing this. There are researches that have been done by even partners, by even government agencies, to the effect that 70% of people who are consumers of health in Nigeria access their health, services from community pharmacy. Unfortunately, because of the lack of team spirit that exists in health sector in Nigeria, where a particular group of healthcare provider sees health sector as their own. So any other person is relevant.
It's a very joyful event to me and a welcoming event to me. 10 years ago, we've not had such events. I'll tell the populace or Nigeria that the pharmacist is the person you should contact, and self-medication is highly prohibited. We don't like it, we don't encourage it, and that is why when you have health issues, contact the health the health professionals.
According to Mrs. Otote Bridget Aladi, the refusal to indulge pharmacists fully in the COVID-19 administration exercise has really slowed the process and therefore encouraged the need for that.
We know about the pandemic that almost wiped the whole world. A lot of countries have initiated the COVID vaccine, the COVID vaccine initiative, and they are making use of community pharmacists so as to reach out to large number of the population within a very short time, knowing that the pandemic is an emergency that needs to be handled headlong. But in our country, that we are not seeing yet. And I believe that's one of the reasons the number vaccinated in Nigeria so far is very small compared to other countries and compared to our population. They are underutilized. The pharmacists, particularly the community pharmacists, are underutilized. They are well trained and they have all the professional and technical know-how to handle vaccination and other primary health challenges. I think a big factor why it's like this is because of the interprofessional feud among our healthcare professionals. As we know in our country, the doctors are always at the helm of affairs and they want to have it all. They want to be the only ones to be recognized. But the truth again is, in health practice, the patient should be key. It should not be about self or about self-recognition, but about what is good for the patient, what will the patient benefit from.
Oh, as a pharmacist, like any other profession, there's no profession that doesn't have challenges. They only vary. The challenges we have as pharmacists is because of unprofessional practice members that are coming into the industry. Just like any other one, there are quacks, there are people that have just come in to make money. They don't have the interest of the patient at the heart. But that is, we are trying to correct it, but some people came in because of money. Any trained pharmacist come for the interest of the person, of the patient, not money first. Money will come, but money should be secondary. But there are so many that came because of money. Health, when it concerns health, is every man's own challenge. But except somebody is enlightened or educated, he may not know what to do. There are so many sicknesses because pharmacy is the first point of contact for any person who is sick. So if the public is made to understand who a pharmacist is, our healthcare system will be better.
Zainab Ahmed, Voicetv, Nigeria.